Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Alejandra, Content Marketing Specialist at 3W Medical for Women and the host of today's podcast. Hello and welcome back to another episode of Wellness Wednesday here with 3W. My name is Alejandra and I'm here today with Kris, our nurse practitioner. Hello, Kris. How are you doing?
I'm doing well. Good to be with you.
Thank you. Thank you so much for being with me on this Wellness Wednesday episode. And it sure has been another beautiful week here in Seattle.
Yes, absolutely.
So beautiful. So again, so grateful for you to be here with me on, and this is your first podcast with us.
It is, yes.
Right? Mm-hmm. So I'm sure you're super excited.
Yep.
Well, today our topic is Sexual Assault Awareness and Prevention Month. And this is a very, very heavy and serious
it's not
topic.
A happy topic.
No, I'm so sorry. It's your first podcast, but it is important to talk about as we bring awareness in this month of April and just have a couple insightful ways that we can really help our community because it is something that happens frequently and often. And I'm sure as we have our conversation today, we're going to learn just a lot about what to do, what not to do, maybe things we didn't even know about, right? So thank you so much again for being here.
Absolutely.
And let's discuss this important topic. So, and now that we know this month of April is Sexual Assault Awareness and Prevention Month, where can we even begin with this topic? How is it that we can even dive into it?
It's a good question, and I'm not sure that there's a specific starting point, but I think just even having the podcast and being a part of what the rest of the culture is doing in terms of, designating this as Sexual Assault Awareness Month is a starting point for us to talk about it here and to get the word out to our clients that we are aware of the need to talk about this.
Yes.
And become aware and do what we can to prevent this from happening.
Well, that's a great starting point. How would you define sexual assault?
Well, I will give you a definition.
Okay.
Sexual assault, or you might even say sexual violence, is kind of a broad term, and it would refer to any form of forced behavior or inappropriate or unwanted sexual contact. It could be, on one end, from forced touching or kissing, or it could be more physical than that. It could be a coerced vaginal, oral, or anal penetration. And this does include situations in which the victim can't give consent because they're intoxicated. They're unable to understand the consequences of the behavior, or there may be misperceptions because of age or other incapacities. So it's kind of a broad definition. It includes a lot of things.
It does. And how common would you say this happens? Because we can think, oh, this is probably not so common and it's probably with people we don't even know and it might be a very, very small percentage. But as we've learned throughout the years, it's quite common, correct?
It is common, and it's more common in certain age groups. Adolescent and young women, and the specific ages that are documented are between 16 and 24. They're the most likely victims of sexual assault, more so than women in any other age group. Another thing that might be of interest to you is that most sexual assault survivors, up to 80%, experience their first assault before they're 24 years old. So it is something that happens more often in younger women. Not that it doesn't happen in all age groups, but definitely even 3 to 4 times as likely in those younger ages.
Oh, it's so hard to hear that, and it's not people that they don't know, correct? It's people that are.
It is much more
usually
common that these sexual assaults would be in a situation where the person that's being assaulted at least knows the perpetrator casually, might be an acquaintance, but it's less likely that it's a stranger statistically.
Wow. So it's more being cautious of who you know already,
exactly.
Which is even more scary because you don't know who it could be. And I think one of the hardest things that I've heard of is it's hard to even say, right? If you're experiencing that sexual assault in general, you feel almost like you can't say anything because you're scared or because there is a mutual acquaintance, with that person or persons. And I think, and I've heard that, I don't know how it falls in with actual statistics, but that people are very afraid and tend to not say anything just because of what will people say? How will people react? And in general, just like many other awareness topics that we've talked about on this podcast, how it's putting up the courage, right? Putting up the courage to talk about them. And so within all of this, what are the risk factors that could, maybe with not saying anything?
Yeah, there are quite a few risk factors, and I would include in those chronological age, which we've already talked about, adolescents and young adults in that 16 to 24-year-old age group. Another risk factor that is very clearly documented is if the person has been victimized before, unfortunately, they have an increased risk of sexual assault again.
Oh, wow.
Which is hard to hear.
And why do you think that is? What the reasoning for that?
Well, the thinking is that it might be related to alcohol or drug use or something about the type of dating relationship or relationship that the victim gets involved in again. And that's doesn't have anything to do with blame. It just may be a belief about dating or what's acceptable in a dating relationship. So the person that they're with may have some beliefs that aren't accurate or okay.
Okay.
And then another risk factor is having lots of dating or sexual partners.
Okay.
And an early onset of sexual activity. So maybe having some maturity is a preventative strategy.
Wow. So there are a lot of risk factors. They can, it sounds like, from dating, from maybe even culture, acceptability of certain things, how early, right? And so I know we hear about prevention, right? And as we bring up these topics in our podcast, with our variety, we always want to have that sense of prevention and awareness. What are some good prevention bullet points, you could say, for, our community? Common things that we can say, if I'm encountering something, or if I have a friend who is encountering sexual assault at work, in her family, what are things that they could do? Even us, working here at 3W, some good things that we can, just be on the lookout for. What would you say?
I think just getting some information for yourself is the very first step. And Alejandra is going to post after the podcast a really helpful fact sheet on our website. So you can access that. And it's developed by the Centers for Disease Control. So it's very well-known organization that is concerned about all aspects of our health. So I would refer you to that and get that good information for yourself. We'll also post some other websites that you might access to just get yourself informed. We know that prevention needs to start at an early age. So in our families or our extended friend groups, I know it's not a really lighthearted topic to bring up in casual conversation, but with people that you know well and care about their health, this is something to start talking about with young girls, young boys, and try to help them understand healthy dating behaviors. The research really bears out that it's that young age group that we need to influence. So as they grow up, they know what's acceptable and what isn't.
Right.
And so you can put away some of the myths that are out there about what is okay in dating relationships and foster a more healthy picture of what dating and relationships should be like.
Right. And I heard you talking about beginning it within your family, right? And it makes me think of as a kid, I was probably 7 or 8 years old, and my mom had this back when we had the VHS tapes. It was this safety video, and she put it on for us, and we kind of just walked through, these safety procedures of what you do when you're crossing the street. What do you do when you see a stranger? And there was this one point in the video where it was saying, what do you do if you're walking down the sidewalk and a car stops? And the person in the car tells you to get in. What do you do? And I remember that being ingrained in my mind, like, what would I do if that happened? And I'm kind of a very cautious person anyways when I'm in public and I don't know who, cautious of my surroundings. And so that has always been ingrained in my mind. Like, you do not get in the car when somebody tells you to get in the car, and that too is very common. We don't realize how common that is as well. And we might be in our neighborhood and something might happen. And so it's just like having that general awareness. And I appreciated that. My mom had conversations with us, like, you don't get in the car with a stranger. Even when we would go to the grocery store, she would go through her list of, you stay by me. If you get lost, you go to the clerk at the counter. But yes, just those things, those just general safety things that we can talk about as young kids. And of course, like the parents taking that initiative and what they want to share with their children. But you're right. Just even the dating. What are good dating habits?
And I think along that line, Alejandra, thinking about some of the risk factors, we know alcohol use is a risk factor for violence. So there are some really specific behaviors that are recommended around decreasing the risk of that. So, and I can just give you a few, in terms of not taking a drink from someone you don't know.
Right.
Not leaving your drink, if you're choosing to drink, don't leave it unattended so that anyone could tamper with it when you weren't there. Other things, it's hard. Peer pressure is hard. We know that. But trying to resist peer pressure around needing to drink or take drugs. Right. Because that just increases the risk of the possibility that you might be victimized. So again, just things that may seem like common sense, but getting back to your mom, giving you those very specific tips about how to stay safe, these are some other ones.
Good. Yeah. And for all our listeners out there that are, teenagers, young adults, like these are all good pieces of information, to be aware of. And we may have heard them over and over again too, because it's like not
common sense,
exactly.
Right?
Exactly. It's putting those, tools in your toolbox to just be aware of. Because we think, what are good things that I need to know as far as, starting my life as a young adult. But these are good things because they're related to our health, and just this is our Wellness Wednesday podcast. So what do we talk about? Health and wellness and that prevention as well. And so to tie it in with what we do here, Kris, and now that you're one of our newest medical providers, what is something that you see, or something that you would bring into every appointment, especially with that prevention and awareness in mind?
It'll start very early on in your coming to our clinic. There's an intake sheet that we'll ask you to fill out as you're anticipating having an appointment here at 3W. And one of the questions on it it's a traditional question that you'll encounter in many healthcare settings. So we have that as well, is do you feel safe in your relationships? And because we have these statistics that tell us, unfortunately, how common sexual assault is, we will look at that, knowing that it's possible that the young women and men that come into our clinic might not be safe in their relationships. So we would follow up with you and how you respond to that question. And even if you respond yes, because we know that some of our patients might not be safe, don't be surprised if we give you a little more additional education about it and just say, I see that you're safe in your relationship. We want to just give you some more tidbits how you can keep safe in the future.
That's so true.
So we will be just assessing that for your life and also continuing to educate you.
Yes. And I love that you say that because that's exactly what we do here, right? Within that hour appointment, whether it's just a consult, whether it's that well woman exam, having that constantly in mind. And for those who don't know, we do have hour-long appointments. And that's one of the most amazing things about 3W is you have a whole hour to do everything that you need to do, but also ask all the questions that you have. And if you are, experiencing this, if you are in a, unsafe relationship or have experienced sexual assault, this is a place that you can know you have our support as women, as young women, as adults, and all our medical providers that are so wonderful, just like Kris here, who gets to have that one-on-one conversation with you and let you know that you are cared for, Yeah,
come in with all your questions. I love that, Alejandra.
Yes.
And then you probably will have more questions while you're here, and that's fine. And if we don't have the answers, we step out of the room and get information for you.
Exactly.
So hopefully you will leave here having your questions answered as best as we can.
Yes. Well, Kris, thank you so much for this insightful information on this very hard topic, but we so appreciate your insights and your research.
I have one more PS.
Yes, please.
And this may be the most important one, just for women and men in general. Trust your instincts.
Yes.
If you're in a situation and you're, I just say your gut, but that's very non-specific. It's non-medical, but you kind of know something is not right. Go with it. Don't second guess yourself. It's just really important that you learn to trust that gut.
That gut feeling.
Nothing else. Alejandra knows what I mean.
Yes. It's so true. It's a lot of times we could say, oh, well, no, it's not a big deal. Put it under the rug. But in reality, it's
go with it.
Yes, exactly. Well, I so appreciate you sharing with us, Kris, all this information. And I know this won't be the last time that you'll be on here with us. So until next time, please share this podcast with your friends, family. This is very insightful news information. So, and thank you so much for all those that are listening. And thank you so much, Kris, for your time.
Thanks for listening.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you liked this episode, please share it with others and consider subscribing on your favorite podcast platform so you'll never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.